All right. Good afternoon. I'm with Dr. Alex Chua from Internal Medicine in Fairfax County. I am lucky enough to know Alex from my best friend, Shauna Kochi. That's his brother-in-law, and I was able to meet Alex a couple years ago. Great guy. So, Alex, why don't you tell us about yourself, a little bit about what you do, and then we'll jump right into it.
Sure. So my name is Alex Chua. I was raised essentially in Maryland. Went to undergrad with a finance degree at University of Maryland. Did a couple years of healthcare finance. Really didn't feel like that was my calling, so I ended up going into becoming an EMT. And then that really made me feel in love with medicine and the sciences. And then I got into medical school at George Washington University, graduated there, and then did my residency in Delaware in internal medicine and pediatrics, and then came back to Fairfax for my kind of end dwelling, I guess, with my family.
Awesome. So, you touched on the first thing I wanted to talk about with the long hours that it takes to be a doctor. Like, what is something that a lot of people don't see on the outside that goes into it that you can explain, like, wow, like I didn't even expect that. Like, what was one of the biggest eye-opening things other than the long hours that you didn't expect?
Other than the long hours, I think that I didn't realize how much medicine now has become more customer service based than anything else. I went into medicine thinking like, I'm going to help everyone. I'm going to help the entire world. I'm going to help my friends, my family, and I do. But at the hospital, you realize that there's a lot of patients who is there not just because of their illnesses, and because of that, and they have other complexities to them. It's all about winning their trust, winning their approval, winning their I don't know, their ratings of you, and that means that you got to work with them. You can't just be like, "Hey, this is what you have to do. This is what happens," and that's that. Like you don't have the last voice in the room. They do, really. So that was a big shocker when when I got fired for the very first time by a patient. They're like, "Hey, I don't like you. You can go down." I'm like, I just met you, man. I don't know anything about you, and now I'm being yelled out of his room. So it's one of those things where I'm like, wow, I didn't realize that. Medicine is more than just like taking care of the sick and like taking care of the ailing. It's a lot more than that.
Yeah, I think that's an interesting point that from the outsider perspective, I wouldn't have thought about because you deal with medicine all day, but you do have to take into consideration the personality aspect of it, of your patient, and every patient's different and every
Hmm.
circumstance is different. I think that's a great point. So that kind of segues into my second question. So along your medical journey, obviously it's a long journey because you have to go to undergrad, graduate school, then you have to do your all the stuff I don't know the names of. But at some point, were you ever questioning yourself on how long of a journey it was? Like, were you like, was this really for me?
I mean, really all the time. I think, coming from as a Asian son, right? Like all my parents always wanted was doctor and lawyer kind of thing. And so even though I was interested in business, like my parents still wanted me to do medicine. So I had done finance in undergrad, but also did my pre-medical studies at the same time. Um, and even though I wasn't that fully into it, I didn't know why I wanted to do medicine besides, because my mom and my dad told me so. Um, I still applied to medical school 3 times just to try to get in. And it wasn't really until when I became an EMT that really like hooked me and hooked my own interests. But throughout the entire, like, even from the studies, the long, grueling hours in the library, memorizing books and memorizing slides and memorizing anatomy to the late hours in residency where you're working. I don't know, you're working 6 days out of 7, and you only really have one day off, literally one day off on average, so you could be working 2 weeks straight, and then you get 2 days off, or you can be working 3 weeks straight and get 3 days off, kind of thing. I think those times really question because the days seem endless, the hours seem endless, and there's never a end point to say like, oh, I'm finally done, because there's always more work to be done. There's always more sick people coming in. So that was definitely a huge struggle to say like, am I really going to get through this? Am I really for this? Um, yeah, it's been, even, I mean, even nowadays, as a full-blown doctor and attending, you sometimes wonder, when the cases get very difficult, or you miss something, or you didn't ask something that you should have, and it comes back like, oh, like, maybe that the patient could have had a little better outcome, maybe not. And then you wonder those things of the maybes. Um, and yeah, very, very much so. In medicine, there's something called imposter syndrome, where it's physicians all alike all experience it, where you feel like you're never enough. You feel like you're the only one that's lacking in the room, and everyone else kind of knows everything, but then like you don't know that one thing. You don't feel like you fit in, and that's one of the things that almost every physician, not almost, I'm pretty sure every physician encounters and struggles with their daily lives and daily careers.
Right. No, I think that's a hard thing in any industry, right? Imposter syndrome, especially when you try to keep going to the next phase and you finally feel like you made it and then you question yourself. I mean, that's like in any sport really. But that kind of segues me into another question of like, how hard is it to separate Dr. Alex Chua from regular life dad Alex Chua? Like, is that difficult some days?
I it is difficult. I think, and I still struggle with it, because um how I am with my family and my kids when they're sick is it's not what my wife would expect, right? Like, my wife would expect a very like calm and gentle, soft spoken, like very comforting, kind of lovey dovey kind of guy. But when my kids are sick, I'm very black and white, number one. But you would think that, like, with all this doctor training, you would be so prepared for anything that your children can have. Whereas I'm actually the one freaking out usually, and my wife is the one who doesn't have medical training. She's the one that um, keeps us grounded and level-headed, right? This issue is that, like, when it comes to home, and it's private, and it's personal, it's vulnerable. Um, Everything is up for grabs, meaning like, you can have like all these kinds of complexities that you've always read about, heard about, even seen, and suddenly you're like, oh, this must be this one, this must be that one.
Yeah.
When reality is like, yeah, they probably just have a little sniffle, it's probably going to be okay. But my mind's already running to so many millions of miles in many different directions, that in order for me to reel myself back in, I have the first thing I cut out is the emotional part, which is the part that as a father you really want to connect, right? Like, kids will get sick, and it's not about avoiding them getting sick. It's not about really getting them feeling as good as fast as you can, because you really can't really do much. But it's really comforting them in that time of illness, right? It's meeting those children, meeting your kids in that time of illness, and allowing them to know that, hey, you're safe. I know you don't feel well, but you're safe. And that's the one element that I don't provide at home.
Right.
Um, and in a sense, like, I do that somewhat at work, but I also cut out a lot of the emotion. And I found that a lot of us do that because it allows us to protect ourselves from the vulnerability. And I think that's one of the things that even to this day I still struggle with at home, is like, how do I let down those guards? How do I also comfort, yet also be okay to feel like afraid, vulnerable, like I don't know what to do, I don't know what to do, and that being an okay point, right? It's not like I don't need to know everything about this is what the kid has and this is how we're going to work it up in those things. It's just about being present. And it's a very different switch. So to kind of circle back, it's very hard to switch off Dr. Alex from just regular daddy Alex. Because those elements that you use to protect yourself in the work setting, you bring home as well. And that can seem kind of cold shoulderish, I guess, especially in the times of need where, if Sarah got hurt, I'd be like, well, Sarah's my wife. I was like, when Sarah got hurt, I'd be like, oh, just take some Advil or like take some Tylenol. Like, yeah, she doesn't need me to tell her take some Tylenol, take some Advil. Really, she's like, oh, are you okay? Oh, let me see it. She just wants to be a little like loved on. And I don't do that at work at all, right? I'm like, all right, let me calculate, let me see what we need to do, let me run whatever tests I need to do. And that's the exact opposite of what is asked of me at home. So it's a struggle for sure. Being able to flip that switch and being more vulnerable at home and not being vulnerable at work.
Right. And then what would you say the hardest part about working those long hours is because you have a family and obviously a loving wife, like I'm sure the long hours are a struggle. Like how do you work around that and still get time to see your kids?
Good question. So I think in residency, which is our training, where I was working legitly 6 days straight and then one day off, 6 days straight with at least 12-hour shifts. A lot of times more, like 14 hours. It's I'm not sure if there's a good kind of how did you make it work. I think it's really a test of patience, test of marriage, test of everything. I can tell you that at that time, especially when Maddie's health wasn't as good, like everything really was at its precipice of almost breaking. Our marriage was almost in shambles. Like I was never home. I was never emotionally present. I was always at work. And then when like I was planning my life around work, we didn't know anyone else in Delaware, so that was very difficult of a period to say like how to do it. So we were in survival mode, right? We weren't really connecting. We were just trying to survive that period of our life. Nowadays, what we found was that you have to have a level of grace between the two of you, um, where she knows like, hey, if I text you and saying I'm leaving now, I could be leaving now, or I could also not be leaving for another hour. And initially, whenever she got those texts, she'd be like, "Oh, why are you still at the hospital? It's now like an hour later." I'm like, "Hey, something came up. I'm sorry." And then there'd be like little kind of hurt feelings from that to now like she gets it like, she's like, yeah, if he like she checks my location on the phone like, oh, he's still at the hospital, he's probably not left yet, and like that helps her start planning, being as open as you can about like, hey, I'm not going to make this, I'm not going to make that, and not over promise. I think is huge. And being just gracious, like if things come up unexpectedly, and they are going to come up unexpectedly, uh, it's okay, right? And
Yeah.
giving that, extending that grace to your partner, say like, hey, I know you said this, and I know you didn't deliver that, but it wasn't out of ill intent. It wasn't out of you trying to like whatever, but it was truly that's just how the cards played out, and that's okay. And giving that kind of grace really helps mend the complexities in life.
Yeah. And I think you said a couple things that I don't know if you did knowingly, but it brought me to my next thought. Like those long hours, the amount they push you guys in residency and even after, do you guys put enough emphasis on mental health, do you think? Or is in the doctor world, because obviously you're the doctor and that's what you guys are advocating for. Do they at least be like, hey, we need to check in on you. You've worked 80 hours, like,
Yeah, good question. So, in residency, so or training, they definitely tried to put an emphasis, and but at the same time, and I'm going to try to explain this distinction is that they had people available to talk to. We had counselors, we had check-ins with a mental health counselor as a group, even as individuals. But despite that, right? If you are, let me try to create an example for you. Let's say you just you're in debt, you're in massive debt, and you had an addiction to gambling, and you went and gambled more money that you didn't have. And then as you're driving to the therapist's office, you crashed your car, you totaled your car. Now you're walking to the therapist's office, and you get there, and you sit down, and the therapist is like, "Hey, you know, how are you doing?" You're like, "I'm not doing great." And he's like, "Oh, are you doing these kind of exercises? Are you staying positive? And are you like, yeah, I'm doing all those things, but life just sucks right now. It sucks." And they're like, yeah, tell me more about it. And you tell them more about that. Yeah, that sounds very difficult. And then you leave your session and then you walk your butt home. Like that's kind of the nature of the medical industry, is that it's such a demanding job psychologically, emotionally, physically, that even though they offer, um, these kind of counselors and things, at the root of it, it's a medical industry is one of those healthcare industries is one of those industries that really take from the physicians and the nurses and all the providers. They take and they don't really give back in equity what they take from us. They it's I don't know how to describe it. I mean, there's a lot. It's huge in now mental health in the medical world, because you hear a lot of stories about medical students committing suicide, physicians committing suicide, and it's a really real thing. But it's one of those things where having more access. I don't think the issue was ever with access. I think the issue at the root was the fact that healthcare in America is not done as humanely to the people providing that healthcare as other places, and I think that's where the root of change needs to start. It's not having more counselors and more meetings and more like team workshops and going to golfing. Like those are all great. Those are all good. But if you really want to solve the, hey, let's nick that deadly thought process of like, I'm not good enough to, like, I can't control anything, to now I can't really control my life, and ending it. And let's kind of reel it back as to, well, why did that person get there to begin with?
Right.
Is it the fact that they've been working nonstop for the past 3 days and they've had four people that died when they had to work on trying to get them well? Is it the fifth patient that they encountered that spat in their face and like and cursed at them before they walked out against medical advice? It's so much complexity, yet you really don't have much control, because those patients just keep coming and coming and coming, and you are expected as part of your job to handle it all, and that's a lot. um, the amount of patient loads that we see, right? And some days I will see 19 or 20 patients in a day. So you want me to hear in one day, right? In a 24-hour day, you want me to hear the stories, enter the lives of 20, 19, 20 people that I've never met before, who are sick in the hospital, who may or may not need some bedside procedures that I would have to do. Then as well, talk to these families. And as I talk to these families, by the time I get to number 18, 19, patient number one's family has more questions or have more issues, or that patient starts getting worse. So I'm constantly circling back to figure out what's going on. That is like my 7 days straight, right? And so you experience that kind of thrashing, and some of my colleagues call it just a thrashing. You come to work, I can't believe I'm back here again. You get thrashed for 7 days, and then some weeks you'll get 7 days off. Some weeks you'll only get maybe 3 or 4 days, and then you're back again. Or some days the schedule gets messed up, so you get like one day off, and you work 2 days, and then you get 2 days off, and then you work another 3 days. So you never really get to reset. It's that industry. This is the industry of medicine in America, and I don't know what to say, and I apologize. I kind of went on a tangent there. I forgot your things like, how do we survive, or it's you just do, and you find ways to kind of cope with it. A lot of us cope with it by like separating our emotional vulnerability selves from from the work. A lot of us make dark jokes, in the workroom to kind of separate the trying to build some humor into something that you couldn't humanely interpret or digest. We all find different ways to cope, some not healthy than others, but certainly it's the industry that's really breaking us down more than anything.
Right. Yeah, I mean, I can only imagine where you're expected to be on your A game for that long and that many days in a row. It's gonna weigh on you. And not to switch gears completely, but I think it's important to talk about our personal connection. You were an integral part of my wife and I last year in our journey when we found out our son had a very complex heart, transposition of the great artery, otherwise known as congenital heart disease. And you talked us through some tough times because your daughter has not the same situation, but also a very complex heart. How difficult is that A, living with, knowing what she has, and B, how do you go on your day to day trying to get her to live the life that she deserves, but also knowing what she has?
Oh, heavy question. So the the first question I would say is that there's a lot of feelings that surround it, especially because I've seen a lot of stuff. I've just seen a lot of stuff, and so to to say like I worry or I get anxious is really maybe even just a not it doesn't even really start to scratch the surface of that. There's certainly a huge amount of anxiety and worry and fear, even as a parent, right? Like it's your child. It's your blood. And to know that they have a life threat um, constantly where you don't really have control is heartbreaking. And so I would say that the first thing is, uh, you try to live as normal as a life, um, and you try to uh, not think about the what ifs. And certainly, you of course you can see that when you look at her, she's as happy as can be, and you can't really like it would be selfish to impart those kind of same worries and feelings and concerns down to her. So you do it with your spouse, but it's certainly one of those things where like man, like she was really dealt a bad hand. And you see those, you see a lot of adults and kids that just weren't dealt the same hands that other people, and you see their fighting spirit, you see their courageousness, you see their brave attitudes going in and out of the hospital visits, and that encourages you. But it's one of those where I still struggle with it. Why us? Why what did we do? Or there's it's those have been thought already. Now it's more of just an acceptance of like, all right, well, I know that tomorrow isn't guaranteed really for anyone, let alone for her or me or anyone else. And so you take it one day at a time. You try to be in the moment. You enjoy more in the moment because you know that tomorrow may or may not happen. Um, your second question regarding her remind me your what was your second question regarding her health?
Yeah, so knowing what you know, how difficult is it for you to, as a parent and also someone in the medical field, to almost like in the Forrest Gump movie, like take the leg braces off and let her run free, and obviously to live that normal life that she deserves, but obviously knowing her restrictions.
Yeah, it's tough. I think at we so for her, I know that because she had a massive heart attack and her heart isn't quite as normal as other kids' hearts, she's gonna need a lifelong amount of heart surgeries. She's gonna need valve replacements every 10 years. And the thing that I don't know of is like, well, how many heart surgeries can she have? Because every time she goes under for surgery and she heals, the human body heals with scar tissue. And so scar tissue obviously is not normal tissue, it's not healthy tissue, it's scar tissue. And so it holds different, it doesn't function the same. Things get stuck to it because scar tissue, as it heals, it kind of sticks to stuff. And so it makes going into, from a surgical standpoint, a lot harder each time. And she's already had 4 open heart surgeries. And so the question then becomes, well, like, what if, at what point can she, does she not need a heart surgery anymore? And I don't know that. At what point, is there a new medical advancement where she can grow with a valve? I don't know. So those are all mysteries that I don't know. But I do know is that, I do count the days, the years, the months of, well, and we still have checkups every 6 months to see, how is this valve doing, and how long until she's going to need another valve, and then after that, how long will she need until another valve? And it's just those things where, like, when she does need a valve, it's not like, oh yeah, the microwave binged and like it's time to get a valve. It's more so that she starts having heart failure symptoms. She feels short of breath. She's not as energetic. She looks pale. She's got a cough. She has trouble breathing. And that in and of itself weighs heavily on my heart, right? Because as a physician, knowing all these different kinds of things and seeing all these different kinds of symptoms, does she have a cough because she just choked on water, or is she in heart failure? If she has short of breath, does she have a virus, or is this heart failure? And there's that kind of unknown that as a physician, where we're almost expected to know, that that really weighs heavily on me, and I struggle with that a lot. Of that, the fact is that you can't, you have to let go, yet all you want to do is hold on even tighter, and so that's tough. It's tough.
Yeah, no, and I think that is very difficult regardless of what your child's dealing with, whether it's, mental or physical or health related. And then for me, my son's heart journey has changed me drastically as a man, like how I perceive things, how I take my day to day, how I manage my time. What do you think was the biggest change in you when you guys found out Maddie's diagnosis, and like internally, how much did that like change your perception on, like, I guess reality is what I'm trying to say. Like how much did that really change you?
Yeah, I think, I mean, it changed me a lot. I would say the first thing that comes up to mind is that, like, I I don't know if it's just like immigrant children, but we're always taught to, like, try to save it until later, kind of thing. So we, and sometimes people make jokes about, like, we as growing up kids, we would find, like, sofas would be just, like, plastic wrapped, remote controls be wrapped, and all these things, so that you can enjoy the newness, or try to extend the newness for as long as possible. And that was kind of the mentality, like, suffer now is okay, so you can enjoy that for as long as you can later. And after her heart incident, where we didn't know what was going on, and she literally died at home at 3 months of age, I realized that same phrase that I just mentioned a moment ago, which is that tomorrow really isn't guaranteed, and you have to live each day not like you it's your last day. You can, and that's the wrong mentality. You don't live each day like it's your last day, but you kind of live it in a sense that you wouldn't have any regrets if it were your last day, and you should be treating other people as if it could be their last day. And so you cherish them just a little more, knowing that tomorrow they may not be here anymore. Um, and those kinds of struggles that we've had with her health, her scares, where we would go in for a routine checkup, and then suddenly they said, "Hey, her heart's not good. You have to be admitted into the hospital right now. You're not going home from the clinic. We're bringing you upstairs." And you're like, "Well, what about my work? What about, this? What about that?" And they're like, "Well, you got to make it work because we cannot send you home." It's those kinds of things where, like, or when we found out that she had a huge ballooning of her heart, and that ballooning could have popped at any moment and thus, like, kill her. Like, those kinds of thoughts and things, you realize that nothing is guaranteed. And so I certainly enjoy a lot more. Sorry, funny example. I don't want to uh, go too much of a tangent, but like this morning I was cutting a watermelon. And I'm like, I'm cutting a watermelon, and when people cut a watermelon, you want to cut only the green and the white, and maybe even just leave a little bit of white, not to waste, right? And as I was cutting the watermelon, tasting, and I'm like, man, this watermelon is not sweet at all. And I'm like, all right, well, like, I'm like cutting it and more, and I'm cutting it to the red. I'm like, all of it's like deep red and stuff. Like, it should be juicy here. And you try, and like, oh, it's not juicy at all. So I'm left with like a big watermelon, and I've cut it down to like this little stump. I'm like, all right, now this is like the juiciest part. And it is the juiciest part and the sweetest part. Then the question is like, well, do I just put all the stuff that I cut off and like cut into like little cubes and chop and just kind of mix it all in? I'm like, you know what? No, life is too short to enjoy the clearish reddish parts of the watermelon. You should enjoy the sweetest parts. So I have one bowl of just like scraps that I put to the side that I've been trying to eat all morning, and then one bowl of just the sweets for like the kids and my wife to enjoy. To say, you know what, like, it's okay. It's okay to just, even if you don't want to eat it, just toss the pinkish reddish parts of the watermelon. And it's okay just to enjoy the sweetest part of that watermelon because tomorrow's not
Yeah.
guaranteed. Like,
Yeah.
it's the kind of mentality where, like, it's okay to enjoy a little bit now. You don't have to saran wrap your remote control so you have a brand new one tomorrow. It's okay. Just use the remote control. Enjoy it. And so I think finding that enjoyment, not waiting for her to be more mature in the future to go daughter, shopping, whatnot, but like, go do the shopping now, buy some silly thing now. It's okay. That really brings me a lot more hope, brings me a lot more confidence, than, wondering about, like, well, how do I get her to make sure she's healthy when she's 30 or when she's 50? How's her heart? It's just, who knows? You let tomorrow worry about itself. You stay present and you enjoy the now with her. You have her now. You have your son now. He's healthy now. She's healthy now. And let tomorrow be tomorrow's problem.
Yeah.
And just staying present in that mindset has helped me survive, the struggles, the heartbreak, the anxieties of yesterdays.
Right. No, I think you nailed it. I mean, when we were in the NICU for 21 days and then even coming home, and all the uncertainty that was coming with it, it was hard not to look in the future and worry about his soon to be open heart surgery, that's happening in November. It was more like we got to the point like, let's stack good day on top of good day, and then the rest will fall into place. And now we honestly live in that place where it's like, sure, we can plan things on the weekends and we can put stuff on the calendar in quotes, but at the end of the day, we got to just stack good days on top of good days because that's all we have control over is today. And I have really shifted my
Yes, sir.
mindset to that reality because, to your point, you go to that normal checkup, things can completely shift, right? Your plan is not always the plan. And I think that's the biggest part of being a parent. We have these plans, we have these great ideas, but in the end of the day, our kids and reality will really show us that this is your plan and this is the new plan. Um, so,
Correct.
man, I think your time and your expertise on the medical field and living with a child with a complex heart condition is just a beautiful thing to talk to you because you have so much knowledge about not only medicine but also being a dad and struggling mentally. Like we're allowed to struggle. Like this isn't supposed to be easy, dealing with this, and I appreciate you being honest and open about that. So if you don't have any other comments or questions, I just want to thank you for your time hopping on. I'm gonna chop this up into different segments and make some reels and post the raw footage on Instagram and Facebook. But you're the man, Alex. I appreciate you.
Sure. Yeah, absolutely.
Awesome. All right, well, I'm gonna stop recording and we'll hop on the side for 1 second.